And we're live here in Lagos, Nigeria. Now let's cross over live to the UK, where we have Dr. Essien Okoribe standing by, GP registrar from one of the hospitals in the UK. Essien, many thanks indeed for agreeing to speak with Galaxy TV. I mean, we had a very interesting chat some time back on our prime time news, but between that time and now, how much progress has been made so far in the UK?
Thank you very much, Kelly, for having me on this show. I would say quite a lot of progress has been made in the UK as regarding fighting this pandemic. So from the last time we spoke, we had lots of hospitals filled with coronavirus patients. We had our intensive care beds filled with coronavirus patients. But today I can say life is returning back to normal in the United Kingdom. As a matter of fact, the last report I got from my hospital, we had just 4 coronavirus patients on admission. So that shows us that we are making progress. Also, we've seen that the death rate in the United Kingdom, is reducing day by day. We've just recorded about 61 deaths. Unfortunately, compared to about 120 something that we had, a couple of days ago. So every day we see the death rates go down, step by step, as well as the rate of infection. So that's an improvement for me.
To speed with the very, very latest as regards the Oxford University vaccine or the trial and all of that. What's the very latest?
Right. So the University of Oxford has launched a clinical trial into coming up with the coronavirus vaccine, and just last week they announced a breakthrough in this clinical trial. So the vaccines that's been produced at this moment have been found to be able to develop an immune response in the participants that were involved in this trial. So we had about 1,700 participants involved, and the study showed that about 91% of these participants were able to develop antibodies after having this vaccine on the first dose, and about 100% developed antibodies, I beg your pardon, after having the second dose. So that's a major feat in the fight against the coronavirus. It has also been shown that most of the people who had these vaccines showed little or no side effects. As you can tell, there are lots of people who had worries about taking this vaccine in terms of the side effects and things of that. So 70% of people who had this vaccine had just headaches and fatigues. No serious side effects were picked up. So it is a major feat that we have attained in terms of fighting this pandemic.
Just probably need to share with us your experiences being a frontline worker. Talk to us, how has this played out for you for the past almost 4 or 5 months now?
Well, I would say that the last 4 to 5 months have been, quite challenging, but it's also been an opportunity to learn. Many of us who are doctors now have never worked in a pandemic, so it was an opportunity to learn and to see what it is like working during a pandemic. Initially we were all worried, we were all scared. Unfortunately, in the UK, we've had more than 100 healthcare workers die, due to coronavirus. So there was tension everywhere. And so as the days went by, we continue to gain a lot of courage. We continue to learn more about the virus, and we've improved in terms of our care for the coronavirus patients. So I would say that this has been a learning curve for the healthcare workers during this pandemic.
Dr. Essien Okoribe, let's come back home and talk about Nigeria. I mean, you are Nigerian, but of course you're in the UK. I said last night on Saturday, the NCDC says we are closing in on 40,000. Precisely, we have about 39,977 confirmed cases. in Nigeria, but there have been issues of low testing. I mean, apart from the epicenter, Lagos, I mean, we cannot talk about other states in terms of how strong their testing capacity is. But as we near 40,000 probably by tonight, what's your message to the Nigerian government?
Well, I would say that the problem that we can pick out with the way Nigeria has handled the pandemic is that there has been very low testing capacity in Nigeria. So Nigeria has tested just nearly about 250,000 people in a population of 200 million. So it means that 0.12% of the population have been tested. So the 40,000 that we are talking about is not a true reflection of the current state of the pandemic in Nigeria. A lot more than that would probably have coronavirus. So my message for the government is that this has spanned for long enough for Nigeria to put their act together and start doing massive testing. So we have countries that test in hundreds of thousands per day, and I expect Nigeria to also follow suit. South Africa, just in the south of Africa, are doing excellently well in terms of their testing, and I think Nigeria can look at South Africa and learn from them.
All right, Dr. So just before I let you go, post-COVID-19, what do you make of our lives? Back to normal, or would it take a while for us to go back to our normal lives?
Well, scientists have said that this virus would be with us for quite, a long time. So we don't know if it's for months or for years. But I would say that this pandemic has significantly affected the lives of people. So it has affected their health. It has affected people psychologically. Of course, it has affected our finances and the economy at large. So post the pandemic, it might be a gradual build up of life again. And for those who unfortunately were exposed to this virus, we don't know what the long-term complications hold for them in terms of those that have had significant chest infections. All we can do at this point is to keep working and keep hoping that in no time we can get a vaccine, and in no time this can be a thing of the past.
Well, Dr. Essien Okorebi, just one final question before I let you go. I mean, the coronavirus started out as an epidemic, and then it progressed and became a pandemic, and then there are rumors or fears of an endemic. What does that even mean? Right.
So an epidemic is an outbreak or a spread of a particular disease in a particular region at a particular time. While a pandemic is simply a global epidemic. So the coronavirus, for example, started as an epidemic in China and gradually became a pandemic when it got through to all the nations of the earth. And just like I said earlier on, scientists have said, and so it might become endemic. So like we have the flu virus over here in the UK, it has become endemic, and so every year people have to take the flu vaccine. So if the coronavirus becomes endemic, we would need some sort of vaccine for people to go through it year after year.
And what do you make about the African continent and Nigeria particularly? I mean, if we have to go through that on a yearly basis?
I would say it is a test to the government, and the government would have to rise up to that test. So the health system in Nigeria is in a very sorry state at this point, and if coronavirus gets to a place where it becomes endemic, then the government would have to stand up to that challenge, or else they will have Nigerians die in large numbers, and we don't want that to happen. So it will be a case for the government to stand up to this challenge.
Dr. Essien Okorebi, it's always very interesting chatting with you.
Thank you so much, Kelly.
We'll be speaking with Dr. Essien Okorebe live from the UK GP Registrar, Worcester Hospital, Royal Hospital in the UK. You're watching Galaxy, you're watching Firecrackers rather on Galaxy TV. We're back in